So first, a little general information about Menasha Corporation. The company's been in business for 166 years. Started out as a manufacturer of wooden pails, transitioned to corrugated boxes and plastic bins. Oops. Added graphic packaging and displays in the last years. We're a privately held company, headquartered in Neenah, Wisconsin. We have over 5,000 employees in 80 facilities in the United States, Canada, Mexico, and China. And we have two main divisions. Menasha Packaging prints and produces high-end graphic packaging displays, retail promotional products, and corrugated shipping containers. Ooh, really sensitive. And Orbis Corporation produces plastic reusable containers and pallets. So I wanted to be really brief in general about the company. A quick look at our average claim cost over the past several years. In 2014, our claim cost per covered employee was only 12% more than it was in 2008. Yes, that's 12%, not 12% a year, it's 12% total in 6 years. And you may remember in one of Tom's slides yesterday, he showed us how Cypress clients are significantly below the national average, and the cost he showed was a per employee per year cost of about a little over $9,000, and you can see here that Menasha's at over, right around the $8,500. So we're even less than the Cypress average client. This slide shows a summary of Menasha's current medical plan design. We offer two medical plans. One is partnered with a health reimbursement account. The other one is partnered with a health savings account. And as you can see from the details on this slide, the plans are very similar. The difference between the two plans is the coinsurance, and then the amount that Menasha pays towards the HRA or HSA account. The HSA, we contribute a little more than we do for the HRA account. I think what we have is a pretty typical plan design, nothing really unusual. But what is a little more unusual is the very low share that an employee pays for the medical plan premium. Prior to 2013, the employee share was as low as 2%, but we have been slowly increasing that the last couple of years. As you can see here, in 2013, the employee cost share for the medical plans was 5%, and in 2014, we increased that to 7.5%. In 2014, we also announced some discount opportunities for employees so they'd be able to start keeping their cost share down as we were increasing it. Every employee is eligible for up to 2 discounts. Each discount is worth 2.5%. You can get 1 discount for participating in the Healthy Rewards. It's just the participation. They don't have to meet a certain level or improvement. It's just participation. And then there's a second discount available for being a non-tobacco user. So every employee can earn up to a 5% discount. And this is just a quick look at what the discount means in real dollars to an employee and why they would want to participate in those discounts. This example is for an employee enrolled in a family tier of the HRA plan. Without any discounts, the employee cost would be about $175 per month, with 1 discount $140 and 2 discounts $105. So an employee that qualifies for both discounts could save over $800 a year in premium. We do have a spouse surcharge also. The surcharge applies if the employee chooses to enroll their spouse on our medical plan and if the spouse has access to coverage through their own employer. And as you can see, we've been slowly increasing that over the last couple of years since we implemented it. One of Menasha's strategies is to provide tools to our employees to help them manage and control the dollars they spend on health care. We don't want to just keep increasing premiums and deductibles and out-of-pocket costs and adding surcharges without also providing access to resources that they can help control cost. Because ultimately, if the employee is taking action to be a better consumer, it's also going to result in the company saving money. Menasha has implemented programs with many of those that made presentations yesterday, including Magellan RX AMPS, and American Health. But what I want to focus on in my next couple of slides are some of the tools that we've implemented in the recent years that employees can initiate themselves to help control their own healthcare dollars. We just added Teladoc in January of this year, so I don't have any statistics on usage yet, but employees will be able to save money when they use Teladoc rather than the typical office visit, as Menasha pays the full cost for Teladoc. Our design is set up so there is no cost to the employee, no copay, no coinsurance, and no deductible. Aletheus is an online tool that provides healthcare cost and quality information. So for example, if an employee is looking for a chiropractor or needs to find a provider that for their hip or knee problems or complaints, they can go to the Aletheus site, find providers in their specific geographic area and the average cost for the specific services. The employee can then use that information to help make a decision on which provider he wants to see. This is a tool that's going to be hard to quantify the savings, but of those employees that accessed Aletheus this past year, approximately 20% said they changed their healthcare decision based on information on the site, and 60% said the site helped them save money. One Call Medical has been available to our employees for 2 years now. While not extensively used yet, those employees that have used it have seen significantly lower costs for their imaging tests. And as you can see on this slide, in 2014, there were 64 procedures, and that resulted in over $50,000 of savings. BidRx is an alternative source for obtaining prescription drugs. There are substantial savings available for those employees that take time to research the options. BidRx promotes consumerism, transparency, and competition, but still allows members to choose the option that works best for each prescription. One of the things I was asked to touch on is communications. So this is our challenge. This map is our challenge. We have over 70 facilities in the United States. So at Menasha, the location's HR managers are the employee's primary contact for benefits. And with over 70 HR representatives and managers, my challenge is to keep the HR folks educated and current on their benefits. We have a lot of different methods to provide benefit resources to both HR and employees, and I'm sure they're probably similar to the kinds of things that you do. We have an intranet site loaded with benefit documents and information. We create educational posters and flyers that we disseminate out to the locations every month that touch on a variety of benefit topics. We have monthly HR phone conferences that we can use to educate them on upcoming changes or just to answer their questions. This past year, we've been working with a company by the name of Navigate Communications. They have developed a phone app that we are putting all of our benefit documents, including ID cards on, because we found that, well, probably similar to most of you, more and more of our employees don't have home computers, but they almost all have smartphones. One of the resources that we use that has proven to be very successful for us is a tool called BrainShark. Basically, BrainShark is a PowerPoint document that with spoken narrative, so I can create my document, add the voiceover, just as if I were making the presentation live. It's much easier than making a video recording. The advantage is that all HR has to do is play the BrainShark presentation at their meetings. And I know that everyone across the company is getting the same message. I don't have to worry about an HR person or a supervisor misinterpreting or misstating something. I don't think I have to sing the praises of Cypress to those of you in this room. If you partner yourself with Cypress, oh, I do. If you partner with Cypress, you already know how they make a difference. I've listed some of the things. I'm sure I've left some off. Besides the normal medical claims processing and administrative support that we expect from TPAs, Cypress is also great at introducing us to upcoming trends, suggesting alternative solutions, and introducing best practices. These are services that Cypress not only provides, but excels at. And if I can, I just want to do a special shout out. Renee Oski is my main contact. Thank you, Renee. Without you, I couldn't do my job.
Sapp Brothers has 1,300 employees in about 47 locations in 8 states, soon to be 9 as we move into Missouri. And upon renewal, our enrollment went up about 60. So that number that you saw is a little low now. We have been with Cypress and feel that they are good. And I think as we go through this, you'll see a lot of the good things that they brought to us. Oh, sorry, that's the map. That's kind of the states that we operate in. So our primary plan is a PPO network. Actually, both plans are now. If the employees elect to go out of network, then the 80-20 split becomes a 60-40, probably pretty standard for most of you. We do have a tiered prescription drug plan where generics cost a lot less than the other 2 tiers. And, you know, again, that's probably pretty standard for most of you. That works pretty well. The employees, for the most part, if they have a choice and they understand that they're going to pay more, are going to go for the less expensive option if it's available. Our medical, this is one of the things that we have been very successful with. The medical advocacy program is mandatory for all of our employees. Anytime they go to any kind of a doctor beyond their regular general practitioner, they are required to talk to the medical advocacy program. There could be pre-certification for a procedure if they need one. But we encourage them, even when there's not a pre-certification need, to talk to the medical advocacy program. What this program does is it directs the care to the provider that has the most success in whatever area they need a diagnostic or a procedure in their area, as well as directing them to the facility that is going to charge us the least amount of money. One of, lots of stories about that, but in one particular case in Illinois, we had an employee who needed a procedure to be done, and same doctor, doing the procedure because he was the one in the area that was doing this, but there were 2 hospitals that he operated out of right across the street from each other. One of them was going to cost us $60,000 to have the procedure done. The one across the street was $30,000. Same doctor, same procedure, same everything, just a different operating room a few feet away. So this program has been very, very effective for us. And the thing that the employees like about this, and the reason that they are working with us on this, is that they have more information, Not, we don't approach it as we need to do this to save money, because then, the employees would resist this, thinking it's just, we're trying to be cheap, we're trying to maybe, not consider their health to be the most important. But we approach it as, we want to get you the best care possible in your area with the right doctor who's going to have the highest success ratio and cost the company or the plan the least amount of money, so it's win-win for you and for us. We're not trying to get them substandard care, and they've understood that. We have 28% utilization on this right now, which I've been told by Cypress is pretty good. Last year, the plan saved $33,000 with this program. At other times, it's been higher, as I indicated. We spent about 18 months a year ago educating our employees about this program through flyers, through magnets, through keychain fobs. Just every quarter, we'd give them something else to remind them about the program. Our managers would talk about it in their meetings. And make sure that people were thinking about that. The refrigerator magnets for our folks were what really worked. I keep getting requests for those. But just that education, that constant exposure and reminder has really increased our participation in that. So this is one of the things that has been very successful for us. We also have a lab work where the employee gets, the lab work is paid at 100% if they go to our designated lab, or if they go to the lab that is in the doctor's office. But if they go to an outside lab on their own, or the doctor directs them to an outside lab, then they're going to pay at the 80-20%, which that has done quite a bit of help in saving us money. And the employees, once they got used to it, they didn't understand it at first. It took a while for them to get used to it, but now that they understand what they need to do, that has been very effective. And they've been on board with us to do that. We do use Teledoc. This is no cost. We do not charge our employees anything for this service. This is something, we have a 9% utilization this year. We rolled it out a couple years ago. This is a target area for us to increase participation through education of the benefit, as we did successfully with our medical advocacy program last year. So this year we're going to really work on Teledoc. Last year we saved over $10,000 with this program, even at that low utilization rate. Teledoc, in case you don't know, is a phone-in service to talk to a physician and get a diagnosis over the phone if possible, and if it's a prescription that can be prescribed over the phone, they'll get their prescription called in and be able to go pick it up without ever having to go to the doctor's office. So there's a lot of potential savings there. And it's been working really well. The employees who have used it loved it. They are our biggest advocates for it. So part of our education program will be to tell a few stories from our people where they have, especially the parents, when you've got a sick little child and you don't want to spend 4 hours in the emergency room in the middle of the night trying to find out what's wrong. This is something that they really like. We are using the Argus Claim Review. They target claims looking for patterns of abuse or to see medical necessity on different procedures where there's prone to be mistakes or potentially fraud or abuse. Out of about 300,000 claims that were reviewed for us, we had over $125,000 in savings, so close to 50%. And that's, very impressive to us. It's a lot of money in our plan. So that has been very good. Some of the providers have not been real happy about this, but if they're misbilling things or they did not get the medical necessity taken care of first, then that we don't feel like that's the plan's fault. That's their fault. One of the things, and I didn't have the information in order to put a slide in here about it, but we did start using the chronic kidney disease case management about 6 months ago, and just got the first data just a couple weeks ago that came in on that. Through that case management program, they've identified about 77 enrollees of ours at high risk to develop chronic kidney disease. We do have an older demographic employee population because of the types of jobs that we have. And in the last 6 months that they're just starting with this, they estimate that our savings has been about $80,000. But they have, they did intervene in a case where one of our employees' wives was right on the borderline of needing dialysis. She has diabetes, she wasn't taking care of it properly, wasn't taking her medications. And they intervened with her, started working with her. The case manager connected with her very well, started encouraging her. She started losing weight, taking her medications as needed, and has since moved back on the scale of chronic kidney disease to a healthier alternative, and assuming she continues, will continue to improve and potentially may keep her from needing dialysis for quite a while, if maybe ever, hopefully never for her sake. So that has been very good as well, and the very, very small amount of information we have on case management for this has been very positive. Our employees' feedback has been very good on this because they feel like it's somebody who truly cares about them and is working with them to get the best outcome possible in what is obviously not a good situation health-wise. We just put in this year ACA high compliant plan that's a high deductible. We had to eliminate a limited benefit plan we had. It's not a qualified plan, so we don't have an HSA with it, but our participation in this increased 17 over the previous year, because it does have full coverage, it does offer benefits like teledoc, it does offer the medical advocacy program, and all of these other small, not, well, it hasn't been small for a plan, but these other benefits that the employees can see will really help them in the long run to stay healthy, and that's really our goal. So.
Well, I'm really excited to be part of this product offering that Cypress is having. I'm pretty new to the organization, but rather than doing a timely demonstration of the system itself, I decided I thought I'd just come up here and kind of walk you through the process of what we have to offer. What we are doing is an online enrollment solution. The total package, we can start out at the basic enrollment level with the employees and the employers, and we can go all the way up to doing eligibility file feeds to the carriers. So the process of the online enrollment is we work with the client or the broker, and we gather all of the information, the benefit information, their elections, their payroll schedules, rates, anything related to their benefit package, and we actually build that in our system so that the employees then can go online and create their own username, password. It's the self-service system. So they are given an opportunity to create their own username, password. We set an open enrollment period with the client as well as the broker. We determine the length of the period. The employees then go in, they have their prior elections right in front of them, what they elected in the previous year, and they go ahead and enroll in all the benefits. During the process, we actually have all of their benefit elections built behind the scenes. We have all of their rates, so we're going to show the employer contributions and the employee contributions as they're enrolling. It does kind of accumulate, and it shows a summary on the side that's going to show all of the benefits that they have the options of electing. And as they go through the system and elect each benefit that's offered to them, it will actually check it off along the side. So it's a really user-friendly system, a lot of great things in it. Once they complete the application, the online enrollment process, it's submitted through to their HR person. The HR person verifies the enrollment information and then releases that application to Cypress. Once that is done, the employee can go back in and they can actually print a benefit statement so they can see everything that they're enrolled in within that employer group. We can get as comprehensive as you want. We have groups that are just using the basic Cypress products only. We have groups that are using outside carriers, life, dental, disability, all the ancillary lines, medical, dental, pretty much anything that you want to put in the system we can build. Yeah, so anything you want to put in there, we can put in. Pet insurance, anything really. But it's a great system. It calculates all of the premiums. If they have salary-based benefits, we preload all the demographic information in the system. So any life insurance or disability, anything that's calculated based off of their salaries, all of that stuff is gathered beforehand, so the system will automatically tell them what the benefit amount is, as well as what the employer portion is going to be and the employee portion. So it's a really slick tool. It's great. We're having a lot of success with it. At the end of the day, the eligibility files are sent electronically to each of the carriers, so everything is done real time on our system, and then it's sent electronically monthly to each of the carriers. So it's a great way to keep everything organized in one central spot. And obviously there's a lot of advantages to this. Reduces a lot of HR responsibilities. It's one system. It kind of manages all of the anything related to their benefits. The enrollment forms, distribution of the elections to the carriers. It minimizes lots of questions. It makes you have all accurate information. The system will not let you advance through until you complete all of the areas. It forces complete elections. You don't have to chase after missing information on applications. And it does provide real-time reporting capabilities. So everything is real-time. There's a ton of different reports that you can run within the system. We also have a centralized area for the employees. They can have ongoing, they have an ongoing access to the system where they can they can store documents out there, any documents that are related to their benefits. They have a document library section out there. They also have a web links where we can redirect them to maybe their provider directories, PBMs, any other type of websites that we want to link them to. So it's really kind of nice. It's all in one centralized location. The employees log in, everything's there. The employer can see what the employees see. And then once the open enrollment period is done, we also have the ongoing eligibility maintenance. So any changes, adds, terms, anything done through the employer, they just can log in and make the change, and again, everything's real time. So it's really a great product. I'm excited to be part of it. So if anyone would like to see a demonstration, my contact information is on the sales contact list in your folder, so you can certainly reach out to me. I could do a webinar demonstration to show you the actual system, what it looks like and its capabilities. So.
So to speak. Yeah, and that is our story. We're a small company, so it is unique. And a little bit about our industry. We're almost in the shadow of Lambo. We take paper industry leftover cellulose-based product. We call it sludge, but we just keep that to ourselves here. And we dry it and we granulate it. So when you open a bag of Scott's, those little specks, those could be ours. So we sell to a lot of agricultural-based people that we're just a carrier. And that's our claim to fame. Our Biodac is biodegradable agricultural carrier. So it's a quiet little company, very few employees. I think when we put these slides together it was 29, but I think it is 28, yeah. So we were one of the first clients. I think that's probably worth a 50, you know?
We'll negotiate that. I think I got a 5.
That's just my luck. So, just 8 in the office, 16 in the main plant, and that's 16 people that run the plant, sometimes 24/7, 2 on our packaging plant and 3 on the sales team. And it's not a young workforce. When I put these together, I was just playing with dates, and 49.9 was the average age. So we are set to cross over into the age of wisdom, as I like to say, having done so myself just recently. And it's amazing how much wiser I feel. And it's not only small, but it's a rich health insurance benefit structure. 1,500 individual out-of-pocket max, 3,000 family. That's up from what this thing was just a couple years ago. It was $750, $1,500. And we only collect $20 in premium per pay period for family coverage, which is nothing. And it's been that way forever. Since Kathy said 10 plus years, I think it's been that way since we've changed it. So 14 for single coverage. Coming from an insurance company background, my question was, this doesn't make sense. It's a small group, it's self-funded, it's robust benefits. How are we doing this? I thought it was, when I first saw the amount coming out, I'm like, this must be just catastrophic care, but it is a really nice plan. And we start with understanding, okay? I think we understand as a small company, we're going to have volatility in our costs. Some of you guys with more employees can see a nice trend line. Ours is more like this, and you can almost point to the year and say, oh yeah, that was the year that so-and-so, or this was a good year, and then this year we had a string. So we understand that there's going to be some volatility involved. Our per employee per year as an average is 8.74 versus the 6.9, a trend since 2007. But when you consider that our employee out-of-pocket costs are about $2,000 less than the national average, that sort of accounts for some of that change. So we also understand that the way we're structured with how rich it is, we are going to be a little bit higher trend-wise, but it's not outrageous, and then that's just how we're put together. And we also understand that given how rich our benefits are, that factors into our wages a little bit. We are not at the very high end, but we're not low at all. So it's above the middle, I would say. Just I'm jealous of some of the plant guys sometimes. You know, they do pretty well. So, but you know, we factor that into our total package. And then we do some risk mitigation. And this is where Cypress comes in. They work very closely with us. I think in being so small, it's really incredible how they can help you and respond to you, and they're right there for you. I'm just sitting in Kathy's office, and I hear some of these calls, and you know they're just right there for her. It's great. So we work with them to try to offer the best as we go forward. So we looked at, and this was the first year I sat in on some of these meetings, we looked at stop-loss carriers, stop-loss levels, PBM, we just switched to Magellan RX this year. Stop-loss, I think we had a discussion, and Renee was saying, well, you know, let's see if we can get you a better quote. And so those are the things that we've really gone through. And of course, programs. These earlier speakers have mentioned some of this. I won't get into and this isn't exclusive, but Bridge Health and MAPS, we started Teladoc this year. We know we have some employees that are using it, so we don't have a lot of data yet, but that's just what we have to do. As far as our education program, and you guys know the drill, as employers, you don't do it just once. You know, it's got to be continuous. One of the things you can do as a small company to leverage is Kathy takes people by the hand, the controller extraordinaire, as she's known. She can help people that just walk into her door. And so in lieu of constant education, she does some hand-holding, and she walks people through the process. So in turn, I really feel like we get that same sort of service from Cypress. I don't want to sound too much like a commercial, Tom, if that's over the top. All right. I'm up to 20. All right. Cypress has been great, and I see that. I see that when I sit in her office when she's making a call or when we're in meetings. So our program is going to change. It's a little bit different this year than it was last year. It'll be a little bit different next year. I don't know if 20 years or $20 per pay period can go out all the way into the future, but they're really helping us offer the best for the least, and it has been working for us. So that's my story, and I'll stick to it.
All right, awesome.
All right.